Dan Frumkin has been doing some great reporting at the Huffington Post. That's why I keep quoting him. This is the third piece in a row that I'm quoting him on this, or not on this issue, but three different pieces and on three different issues. But he goes into depth here, and he quotes some industry sources, and he goes to former officials in the healthcare industry, including Wendell Potter, that we're all familiar with. The conclusion is, of course, they're going to try to find every single loophole in the bill to make sure that you still pay them a tremendous amount of money. So, how are they going to do this? Well, there's a couple of different ways. The most important, probably, is that they're going to cherry pick the healthiest customers. Because if you're relatively healthy, you're not going to get sick as much. The likelihood, the percentages, etc. So you're going to keep paying them and not get much out. Well, that's a business model that can work. But if you're older or if you're sick or if you have a pre-existing condition and all that stuff, well, they want to weed you out, right? Now, by law, they won't be able to anymore. So what can they do? Well, here are some of the tricks. They're going to tell, they're going to change the website around so that drugs that older Americans happen to take, they're going to bury on the website. These are minor tricks, but it gives you a sense of the frame of mind, right? And so if you're having trouble finding, hey, is my drug on here or not on here, well, then you go away from that company. The company wants you to go away. They don't want you as a customer. They're legally bound to take you, okay, but they're trying to discourage you in every way. Now, you want to see the perfect example of that? Here is what one of the insurance executives was overheard saying. We'll sponsor dances and make our pitch at 11 p.m. You see, to weed out older Americans who are already bedded at 11 and who can't dance. Very clever. Also overheard saying, we'll put the company's offices on the second floor with no elevator. Now, look, those are not funny jokes, but I give you a perfect example of what these guys want to do. They don't want to take you if you're older or in any way sick. All right, now more tricks. Trick number 2 is they're going to start pushing the high deductible plans. Why? Now, they're legally bound to cover you, but that doesn't mean they can't give you a high deductible. So they make the deductible so high you never want to go to the doctor because you're going to keep paying out of your own pocket. And hopefully, for most people, all they ever do is pay the deductible and they never have to pay out a damn thing. So that's how they make more money. Okay, trick number 3, more burdensome paperwork on the providers. So whether that's a hospital, doctor, etc. And if they make one mistake in that paperwork, sorry, not going to pay it. Okay? Now look, if you put people in charge whose primary motive is to make a profit, you can't be surprised when they try every trick in the book to make a profit. So I'm not blaming them, man. Don't hate the player, hate the game. That's what I'm telling you. We should have changed the game, but we didn't. We left them in charge. I'm just warming up. You want to see how it gets really bad? All right. One provision that experts believe that they are going to go to more now is that in the bill it says they can charge more, up to 50% more, if you have quote-unquote unhealthy behavior. So that's going to replace pre-existing condition. Okay, I can't deny you for pre-existing condition, but if you got anything that's vaguely unhealthy, you're not working out every day. Oh, smoking, forget about it. Forget about it, right? You're eating too many pepperoni pizza slices, okay? Oh, I caught you doing this or doing that. They're going to get into the nitty-gritty. You want to talk about government bureaucrats coming into your life? Wait till you see the insurance bureaucrats and how they pick apart your life to charge you more. All right, and here's another critical one. If you get over the age of 55, good luck to you. The law allows them to charge you 3 times as much as people under 55. Now, you think they're going to take advantage of that situation, given that we already know that their executives are saying, get rid of the sick, get rid of the old, get rid of the old. Find any way to get rid of the old. Okay? So if you're over 55, good luck to you. Good luck to you trying to pay those bills. And here comes the bottom line in all those cases. And they got more tricks up their sleeve. They're going to send in a lobbyist because the law says that the regulations have to be written. So how those regulations are going to get written in the future on the federal level and then on the state level for the exchanges, oh, they're going to have a field day. They've already launched dozens, if not hundreds, of lobbyists and lawyers to pick apart the law and to go at those regulators to try to buy them off, okay? But the bottom line is the same. Two different experts saying, quote, this is a bonanza. They get captive customers. They get to charge whatever they want. No, this bill is not going to work. I'm no longer, let's see, okay, maybe it'll work, maybe it won't, maybe I'm wrong. No, okay. Now, this is not going to stand. What's going to happen is our rates are going to go higher and higher and higher until there's going to be a mini revolt. I mean, maybe you could look at it as an upside. You could say, this stuff is so bound to blow up. People are so bound to get sick of this. And not just get sick of it, they just are not going to be able to afford it. Until we say, no, this is dumb, this isn't working. We can't have this. They got to change the system. This bill did not change the system. Now, of course, ironically, what'll drive me crazy is after this thing blows up and there's a mini revolt, and then they finally change the system, they'll be like, see, incrementalism. First, we gave you a bill that didn't work, so then later you would revolt and get a bill that did work. Why didn't you just get me the bill that worked in the first place? So, no. You know, you could celebrate the subsidies and all the upsides that we've talked about before, yada, yada, yada. The underlying system is the same, and the underlying system does not work. They have all the incentive in the world, and as you can see, they're going to try every trick in the book to charge you as much as possible and to give you as little health care as possible. The private market works great in most fields. Sometimes the government works better for obvious reasons, fire department, police department, etc. When our health is on the line, it's got to be, just for the insurance, government. Why? Because the government isn't, their priority isn't, how can I deny coverage so I can make more money? I don't have a problem with the profit motive. I have a problem with the profit motive being applied to health care where our lives are on the line. If you get cancer, and they're going to try to find every trick to deny you. Burdensome paperwork, this, that, and the other thing. They're going to load you up with prices you can't possibly pay. It's within this industry, it obviously doesn't work. And they're celebrating passing a reform package that they think is reform and that they think fixed the system. They hung the mission accomplished banner, and they didn't accomplish the mission. That is my definitive word on it. All right. So I'm no longer, let's see, this, that, and the other thing. No, it's not going to work.